Addiction and trauma is at an alarming rate right now in America. Today's guest, Dr. Mark McNear, is going to tell us a little bit about his story and how he started his practice as a psychotherapist. I can't wait to get into this episode as he's going to share his own personal story and his journey that led to his practice. Welcome to the Overcome Diversity podcast. Let's go. Dr. Mark McNear, sir, thank you so much for joining me on the Overcome Diversity podcast. It's an absolute pleasure to have you here to share your story, man. Welcome.
Thank you, Michael. It's great to be with you.
Absolutely. So, we're talking backstage and you shared something with me that really blew my mind. And you went through this journey within your practice when it came to the adversity that you was facing. Can you give us and shed some light about your story and your journey, man, of overcoming some of these things when it comes to addiction and trauma?
I'd be glad to, Michael. So my journey began with recovery about 8.5 years ago. I called my doctor and asked her for refills for prescriptions, and it became obvious to her that I was abusing the medications. And so I did not get the refills. She gave me a different prescription. The prescription she gave me was, I want you to go to rehab. And that was about the last thing I wanted to hear that day. And so you're right that I was in practice before and had really been suffering a lot and got to a point where I really wasn't practicing much at all. I was sleeping most of the day. And when I wasn't sleeping, I was watching TV and kind of just zoning out. And so this was a real wake-up call for me. It was a really good thing. I talk about it, being probably the best day of my life and the worst day of my life. So within a couple of days, I talked to my wife. She was wonderful with it. Debbie was really supportive, and talked to my daughter, Emily, who was in Florida at the time. She was really supportive. So within a couple of days, I found myself, on my way to rehab. I was in no shape. I was going through detox. And so I was on my way. My wife was driving me there. And so I ended up in rehab, and it was a real culture shock. I became the patient. I was no longer, the therapist. I became the patient. And so, the one thing that I noticed, and I talk about this a little bit in the book, that idea that as the medications were going out of my system, the memories of my childhood came back really, really strongly. And they were really, really hard for me to face. When I was 4 years old, my dad had fed me carrots and I didn't want to eat them. And so he forced me to eat them, and I ended up vomiting. And he picked me up and threw me into the garbage and said, "Stay there. That's where you belong. You're a piece of garbage." So
Wow.
Those memories came back. And then, Michael, memories of being sexually abused by my dad from the age of about 4 years old to about 7 years old came back to me really strongly, things that I had not thought about in 51 years. And so I'm sitting in rehab and I'm going through, detox physically and also emotionally. And I have all of these memories coming up, and, people are asking me to tell my story. And you know what? I couldn't. And that's where I got the title of the book, Finding My Words, because I needed to find my words. It was something that I didn't have. I was so emotionally dysregulated, having panic attacks, having a lot of anxiety, and just emotionally dysregulated. Couldn't really verbalize what happened. I didn't have the words. And so that's kind of the journey of the book. An interesting thing happened. There was so much trauma in my childhood. When I was 7 years old, the sexual abuse stopped. And I believe it was because we had armed robbery in our home, where 4 men came in with guns. 2 of them stayed upstairs with us as we slept. 2 of them were downstairs with my mom and dad, my aunt and uncle, and my dad had a really big safe in the basement. And so they spent about an hour taking money and rare coins and jewelry and things like that and cash. So, after that, our house really got tipped upside down. My mom began to drink heavily and became an alcoholic, and my dad became very, very paranoid. and odd things, Michael. He broke out a cement wall in our basement and
Hmm.
then gave bizarre stories. He gave my sister and I forks and knives and spoons and had us dig out a room.
What?
Yeah, had us dig out a room, and so he wanted a room so that he could put the valuables in to kind of have a hidden room, a secret room. And so, all of these things. I'm sitting in rehab, and they're asking me to tell my story, and I just sat there and like shook my head and said, I can't. I'm not ready. And so, it was a really hard journey, but a journey that was worthwhile and interesting for me as a therapist to be looking at this going on and observing it and saying, it really made sense to me why I had become so addicted and had so many different addictions. And it was because I had so many traumatic things that I was trying to hide from.
Wow. Dr. Mark, you just laid out a lot for me right there, man.
Yeah,
I need, I need to unpack this because
sure.
I'm hearing this come from a therapist, someone that's working with clients day to day, hearing other people's story.
Mhm.
Then now I'm hearing a man that decided to write this book
Mhm.
and now become much more vulnerable and transparent and share his story. I can't imagine what your childhood was like, and now to hear at this particular stage, it's hard to share it. You know, in America, like we discussed earlier, like this is something that no kid should ever experience.
Mhm.
Can we talk a little bit about, man, what was it like mentally to go through that day to day or growing up in that environment as a child, looking back at it now? Was
I would say, Michael, that I zoned out a lot.
Mhm.
I don't remember a lot of my childhood.
Yeah,
I'm remembering more than I ever have in writing the book and in speaking and doing things like this. But, there's a lot of it that I just don't remember clearly. And I can remember being in school and just being a kid that was really discombobulated, really, really zoned out and could not pay attention in class. And so that put more stressors on me, to go through school and not to have the best grades and to be kind of like wondering like, what is the matter with me?
yeah,
And being in school and being always afraid. I tell a story in the book of being in sixth grade, and my sister had this teacher before me, and my sister did really well in school. And here I come, really discombobulated and not able to pay attention, and my desk was an absolute mess. And I can remember Michael, her getting like enraged with me and picking up my desk because she saw what a mess it was,
yeah.
and just dumping the whole thing on the floor. And I remember her saying to me, you'll never go anywhere in your life. And I can remember just being devastated. It wasn't safe at home and it wasn't safe at school. And so, I wanted to write this to talk about the fact that when people have had trauma, it really, really dysregulates them emotionally and really, really causes a lot of chaos in their life.
That's exactly what I was going to ask you. So you're someone who experienced child abuse as a kid at 4 years old up until your house got robbed.
Mhm.
Then you have to carry this with you into your personal life, your social life, and just keeping that sort of kind of like a secret.
Mhm.
You know, being able to manage that and function with all that weight and all that's going on inside of your mind. How did you handle that and manage that? And I'm asking that question as like you became much more of an adult and you're either getting you ready to be married to your wife or you're getting ready to have kids and things like that.
Mhm.
How did any of that affect that part
Yeah,
or that aspect of your life?
yeah, it affected it profoundly, and I think that I talked about the robbery happened, and abuse happened after that, different types of abuse, verbal abuse and emotional abuse, and just a lot of things happened in our home right on through until I left for college. And so I talk about those events in the book. I talk about, Michael, that just something simple. I had appendicitis, and my dad started screaming at me about my pain, and he said that I ate too much candy that day. And so I'm laying on the couch and I'm in so much pain and he's screaming. And it turned out that I needed to have my appendix out. And I remember going to the hospital and I remember that I needed to be prepped for surgery.
Yeah.
And that was just so painful for me. There was a male nurse that came in to prep me, and a lot of the memories of the abuse came back
Yeah.
at that time. And that's the thing that, you know, I talk about in the book, that the past is not the past when it comes up in the present.
Hmm.
And so, I carried this with me. A lot of it I just compartmentalized and kind of hid,
Yeah.
and some of it, interestingly enough, I hid from myself. And so here I am at 55 years of age, sitting in rehab, and all of these memories are coming up, and the sexual abuse that, some pretty horrendous things happened, during that sexual abuse. And I can remember as a little kid saying, you know what, I'll never tell anyone about this. And here I am at 55, and these memories are coming back with a vengeance, as the medication went out of my system.
Let's talk a little bit about your book, Dr. Mark. So you released this book and you decided to share a good bit about your life now.
Mm-hmm.
Can you talk about what a reader will get from your book and where can they pick it up?
It it's a story, and it's divided into three different parts. The first three chapters is rehab and me not being able to find my words. The second part of the book, the next three chapters, is finding my words, talking about what happened to me in childhood. And then the final part of the book is embracing my words, being able to walk through recovery, being able to restore my marriage, being able to restore my relationship with my wife, and my daughter Emily, and also my son-in-law Brandon. People will get kind of a bird's eye view of, the idea of somebody who went through denial, who had difficulties in his marriage, had difficulties with his as being a father, and then progresses and ends up in rehab, and says, you know what, I'm never going to talk about any of this. And people encouraging me to talk about it, and then me finally getting some counselors and stuff that came alongside me and really helped me after I got out of rehab to be able to write down my story and to talk about, some of the things that happened. So, it's written for people who have had addictions or who have addictions and are currently struggling with trauma. It's also written for people who are watching that happen, maybe with a spouse or a child or someone like that. Give them an understanding of what trauma and addiction, the tie between trauma and addiction.
Right. So when it comes to addiction, there's many different types of drug out there and stuff like that. Can you share your story of like when did that start and when did you actually realize, or when did someone point out to you that, hey, there may be a problem here or something?
Sure, I'd be glad to. So when I was in my mid-20s, I went to New York University and was studying for my master's in social work. And so I went there, and I found that I was really, really anxious and feeling pretty depressed. And so I ended up getting a referral to a psychiatrist in New York City. And I went to him, and he gave me medication. And the medication was wonderful because it made me feel more normal,
Mhm.
and so it calmed me down. And then there were medications to make me more alive, and so I played that back and forth and back and forth for many years. And my wife would come in, it seems like you're taking a lot of medication, and I would be like, no problem, I'm fine. And so little by little I withdrew more and more from my family,
Yeah.
and missed holidays and stuff like that with families, Michael. And so then, when I was 55, called the psychiatrist and asked her for refills, and it became evident. And I talk about in the book that the addictions were evident to everyone else, they weren't evident to the addict. And so that was a humbling experience for me, to have to call colleagues and ask them, are there rehabs around that are really good? And they were like, well, who's the patient? It's like, it's me. I'm going to rehab. I have a problem. So
It's interesting because, having a cocktail of medications and things like that, and you're operating as if it's normal,
mhm.
So I think it's a bold move for you to even step up and do something like that. I want to talk a little bit about the family dynamic and the family aspects of things, because I think that's very, very important. Like, how do you feel, or what was going on when you're knowing that you're missing out or something, or
Well,
you're maybe checked out and stuff like
yeah,
that?
I was.
What was that like between you, your wife, your kids? What was that like?
That's a great phrase to use. Checked out. I was checked out, and I didn't know that I was checked out. So I would miss, family holidays and things like that. They would be going somewhere, and I'd say I'm just not up to it. And
Right.
it was a progressive thing where it got worse over time. You know, um, Getting in rehab and getting my mind clear, and then just reflecting on it. I felt like so sad. I remember that my wife Debbie wrote a letter of impact of
Mm,
how it impacted her.
yeah.
And also Emily wrote a letter, and I can remember we sat in a big circle at rehab, a bunch of guys,
Mhm,
and the counselor had one of the guys read the letter to us. And so the guy read a letter from Debbie and then Emily, and I just sat there and cried the whole
mm,
time. It was really really painful to hear how I impacted them,
mhm.
but also very good to hear how I impacted them.
Do you think, like you mentioned, once you got to college, that's when you started getting the prescriptions. But do you think maybe some of your childhood trauma was a part of the root cause that compiled on top of these types of things that led to that?
Yeah, I think I use a quote in the book by Dr. Gabor Mate, and he says, "Don't ask why the addiction, ask why the pain." And it became evident to me as I sat in rehab and in the subsequent months and years, it became really clear to me that I was trying to avoid the memories that I had from the physical abuse, the sexual abuse, the verbal abuse, emotional abuse. And so that was no easy task to be able to start facing those memories and trying to, be able to, to think about them, to be able to hold those memories and feel like totally emotionally dysregulated and to work on that. And it took quite a few years for me to be able to, and it's still not easy. Some days are not easy. And I want listeners to hear that it's not, a few years out and everything's fine. And that's the point that I make in the book. It's not, guy finds it that he's addicted, goes to rehab, and now his life is no problem whatsoever. I still struggle a lot emotionally, and I talk in the book about struggling with anxiety and with depression, with flashbacks and nightmares, things like that. And so, it's been a really good journey, but it's been a hard journey for sure.
Definitely, it sounds like the case of complex PTSD,
Yeah.
right?
Yes.
And for our listeners that's listening right now that could have been through similar trauma or some sort of trauma as a child, and it multiple things started occurring, domino effects, those sorts of things that led to anxiety, depression. Can you speak to our listeners about what that is, what that looked like for yourself, and then just talk about some other things and some other aspects of things that you would share with them in regards to like helping them?
Sure, be glad to. So I always talk about this isn't very scientific and it's not very clinical, but I think it's a good illustration. I ask people to hold out one hand and I say, imagine I put a dinner plate in that hand, and then I put one pancake, maybe two.
Yeah.
That would be an example of PTSD.
Hmm.
Take the other hand now and take another dinner plate and let's put a pile of pancakes, and that would be an example of complex PTSD where there's one event after another after another after another. I had the being thrown in the garbage, and I had the sexual abuse, and we had the robbery. I had my mom being an alcoholic. I had my dad being very paranoid and being very emotionally abusive. So the stack gets really high. So for me, Michael, what I did is I got into counseling, which was really really helpful to me, and I did a lot of counseling. And one of the things one of the counselors suggested to me, which was really, really helpful, hard, but helpful, was for me to type up on a Word document the traumas that I experienced. And interestingly enough, as I did that, more memories came back. So I would say what I learned to do during that time, because I was a mess,
Yeah.
was, I learned how to self-soothe and self-regulate. I would go to meetings, 12-step meetings. That was really helpful. I was in therapy. I would do things to help self-soothe, like I take a hot bath every morning,
Mm-hmm.
to help my body to relax. I do a lot of coloring. I do a lot of drawing. I play with putty. I try to walk at least a mile every day.
Mm-hmm.
Spend time with my wife. We do a lot of date nights and things
That's
like
important.
that. Yeah, we spend a lot of time together, and I know it's not always the case that marriages come back together, but our marriage is wonderful now.
Mm-hmm.
Really, really good. My relationship with Emily is really good. My relationship with my son-in-law Brandon is really good. One of the things that I Michael, made up my mind in rehab was I wasn't going to tell anyone that I was going to stay sober, that I was going to stay clean. I was just going to do it. I didn't want to tell them, oh, I'm so sorry, I'm not going to do this, I'm not going to do that. I just did it. I
Mm-hmm.
really, really worked hard in counseling, just so many hours of counseling, and I'm still in counseling, and I have no problem telling people that, and so, you know, the other thing that's really important for listeners to hear, I had a psychiatrist in rehab, great guy, and he looked at me and he knew just a little bit of my story.
Yeah.
And he said to me, you know what, Mark, it's going to take you a long, long time. And it did. It took me years. And so, I would say for anyone starting out this journey, it's definitely worthwhile. It's hard, but it's definitely worthwhile. And it's definitely doable to be able to get to the point where you do enjoy your life.
So, Dr. Mark, when I went through counseling for myself, it was kind of painful. I actually
Mhm.
been to multiple counselors in regards to like facing some of my demons and some of the things that affected me.
Yeah.
You know, for yourself, for someone that went through counseling, did you succeed on the first attempt? And then I also want to ask you this as a follow up. You said you had to write things down, and to see things on paper for myself, it came with lots of resentment.
Mhm.
I wanted to talk to you a little more about that in regards to like forgiveness and unforgiveness.
Yeah, I think that, I certainly went through a lot of resentment and a lot of anger and a lot of internalized anger, just feeling angry that these things happened to me,
Yeah.
and subsequently what happened in my life. I'm a man of faith, and my faith is really important to me,
Hmm.
and so in that, I see forgiveness as being really, really important. But what I realized is it's not one and done. It's not like, okay, I'm going to decide today to forgive this person, and that's it. It's not like a photograph. It's more like a movie that plays out, and that I have to keep working on it.
Hmm.
And then memories come to my mind, and then I have to reprocess those and reprocess what's going on in my body. So yeah, I think forgiveness is crucial, but I think that it takes a lot of time also, and you need to give yourself time to be able to process. Resentment is no good to carry around with you, and some people say that that's one of the things that triggers addiction. Is just being so angry and having so much resentment.
Wow. So, being someone that was addicted, and I know that had to have brought you to rock bottom. Can you talk about what did that look like now? Being at rock bottom for me brought me to close to taking my own life and committing suicide. You know, can you give our listeners what did that look like between you and your wife, you and your kids, you and your
Yeah,
staff, you and your employee?
I it was very humbling, like I said to you, to have to call colleagues and ask them for referral, and then ending up for it was for me, and so this process has been really humbling. I think that I ended up sitting there in rehab and just shaking my head and being like, how did I ever end up here? I can remember them going through my luggage for contraband, looking for anything that I brought in that I shouldn't bring in with me.
Mm-hmm.
So things like that were really, really humiliating. Rock bottom for me was just sitting there in rehab and not being able to tell my story, just feeling so much shame and so much guilt and feeling like I destroyed my life. I'm 55, and my ride to the rehab with Debbie was a godsend. Debbie was so wonderful because she's talking about our future, and I'm thinking, you know what, I've just destroyed my life. I really have. And I'm thinking, I'm never going to be able to talk to anyone about this. So my way of figuring it out, Michael, was, okay, I'll go to rehab for 30 days. I'll come back and I'll be fine, and I won't talk to anybody about anything. And that was just not the plan that God had for me, because obviously I'm on here with you. But one of the things I needed to do, I told patients that I was going on sick leave, put it on my voicemail. And I needed to, when I got back from rehab, I needed to extend that time. It turned out that 30 days turned to 90 days, in rehab. And so after I left rehab, I took about 2 years off and just had to work on things
Yeah.
personally.
So for listeners that's listening, that is really, really in tune with your story right now, and they could be on that beginning path of recovery, on that process of recovery. They may be 1 foot in, 1 foot out.
Yeah.
What would you say to that listener right now, man?
I would say to them that it's a really scary thing to think about stepping forward and getting help. But I would say just think of one person that you can go to and begin to talk to.
Mm-hmm.
Just one person. If you don't know anyone, go to a 12-step meeting and just listen. You don't have to talk. I didn't talk. I just listened the whole time. Just find one person to connect with that's going to be open, safe, that's able to hear some of your story. It begins with one step. And my wife has pointed out, Debbie has pointed out, in my journey, Michael, it has been step by step by step. I figured, 30 days and I'd be fine. And then I thought 90 days and I'd be fine. And then I thought a year and I'd be fine. Then I thought, you know, 2 years and I'd be fine. And now I'm at 8.5 and I'm still limping quite a bit. So, and I think that, you had mentioned being vulnerable or being authentic or being real. And that's what I have found in this journey, trying to be real, trying to be authentic, trying to not do image management that I have it together, but to say, I'm a person and I have a lot of brokenness, but I have a lot to offer as well.
Speaking of real and authentic, you're one of the first persons I've ever interviewed and spoken to that was had a practice, I would say, and was going through some stuff. And normally you don't hear that.
Mm-hmm.
So I actually like that because it create a level of connectivity, as in you're real, you're authentic, you've been there before. I wanted to talk to you if you could talk a little bit about what was that like, either previously dealing with patients or afterwards dealing with patients. What was that like when it came to like connecting with people that came to you for help?
Interestingly enough, I've always been really good at connecting with people. I think that I learned to be a therapist growing up in my home,
Mm-hmm.
with all the chaos there. I would say now I'm much more open. I I was thinking after reading the book or writing the book, when people read it, like, whether I'd have to go get another career or do something else. But you know, but Michael, people have been so receptive and have come, and some people have opened up a lot more and said, I never told you this, but I really struggled with A, B, or C.
Right.
So I think that me putting out there a lot of the struggles that I had has given people permission to talk about things that they had never talked about. And so I didn't know, I felt that I wanted to write the book. I felt like God wanted me to write the book. And, I wrestled with him quite a bit and told him, no, I'm not going to do it. And, we see how that worked out. But, just that idea though, of being more authentic and being real. And if you would have ever told me 10 years ago that I'd be sitting here with you, I'd be like, there is no way, but I have found a lot of freedom
Yeah.
in being able to talk about my story, and have people like lean forward and listen to my story, not pull back,
Mm.
and so that has been really good.
So you touched on something that means a lot to me, man. You touched on your faith. Can you talk a little bit how your faith and belief helped you along this journey going through this process?
Sure, I would be happy to. So when I was 19 years old, I had a car accident. I got hit head on. I need to add to the pancakes, right? And so I got hit head on and ended up breaking my leg and having problems with having pulmonary embolism where I stopped breathing in the hospital, things like that. And so I got out of the hospital and I started searching like crazy, kind of like, what is this life all about? And so I bought a book by Norman Vincent Peale, The Power of Positive Thinking. And in
Mm.
that book, he talked about getting a Bible and underlining verses of faith. And so I got a Bible. I didn't know what I was doing, and I underlined verses of faith. And so then it said to go to church. And so I started going to church, and somebody, had challenged me to start a relationship with Jesus Christ, and I did that. And so I ended up going to Bible college and then going to be a therapist. And, through my addictions, lost a lot of, I had values and I lost a lot of those values and I went against a lot of those values. And so that's part of my journey too, to find, for me to find out that I felt like I had disappointed family, I disappointed friends, I disappointed just about anyone I could think of, but also God. And so felt like I was so far away from him. But to see how he showed up in my mess was just really, really encouraging for me. He showed up and he showed up with grace. He showed up with mercy. He
Always.
showed up with love and just said, come. And so that has been, so exciting for me to get back to church and to have a church where I can share this stuff is really, really important to me.
Man, that's amazing, man. So speaking of a church family, I know you can't do this by yourself. Can you talk a little bit about, outside of your immediate family, can you talk a little bit about a support system that helped you along this journey, whether it's mentors, whether it's coaches, whether you was listening to a certain book, a certain podcast, or something of that magnitude that helped
Yeah,
you along this journey, man?
I would say all of the above. I was very I was very determined to get better. So I started with a counselor and he was phenomenal. I then went to another counselor that encouraged me to dive into, my story more. I've done a lot of intensives, with people learning just narrative therapy, learning what my story is. I joined a men's group and it has just been amazing to see step by step how it's happened. And now Debbie and I are going to a new church. We've been going there for about a year, and it's just phenomenal. I'm going to be in a group with one of the other pastors, just leading a small group. And so I have a men's group, and I have a lot of friends, and that's been something that's really, really important to me, to have a lot of friends that I can reach out to. And so, yeah, I've covered all the bases as far as, like I said, I was very determined. And so, just moving ahead day by day and realizing, it didn't take 30 days and it didn't take 90 days and it didn't take 2 years. It's taken and it's going to take the rest of my life. And that's fine. Like I'm good with that. I'm in recovery, on so many different levels.
I love it, man. So when someone comes to you and comes to your practice and comes to your company now, what is it should they expect when working with your profession?
Yeah, I think they should expect acceptance and grace, because that's what I got. I help people to explore their stories and I help them to do it in a safe way where they can take time with their story. They don't have to rush it all, and there's no judgment, there's no shame, there's no guilt. It's just walking through and understanding that a lot of these maladaptive behaviors, a lot of these mental health issues, things like that have come about as a result of the trauma that they've experienced or the abuse that they've experienced.
Wow. So as we get ready to close out, man, your life's journey has been amazing, and to see the 180
Mm.
look at it, man. I'm just applauding you, man.
Thank you.
Can you share with our audiences some words of encouragement, some life lessons that they could just take away, and hopefully it's resounding and it's an impact, and they could start taking action on some of these things that you share with them, man.
Yeah, I would say two things come to my mind. One is that I've already mentioned, find somebody to talk to. Just find one person to talk to, to share your story, to begin to share your story. Somebody that's going to be safe, that's not going to roll their eyes, that's not going to sigh, but somebody that's going to hear your story and move toward you, not away from you. Find somebody that'll keep it confidential. That would be one thing, Michael. The other thing I would say is, something I've been practicing lately a lot of is gratitude in the mornings.
Mhm.
Just sitting and thinking about all the things that I have, not the things that I don't have or the things that I'm struggling with, but just thinking about and just lifting them up to God and saying, you know what, I'm really grateful for the day that I called the doctor. I'm grateful for, going into rehab. I'm grateful for my family. I'm grateful for Debbie, and I'm grateful for Emily and Brandon. I'm grateful for the things that have happened in my life, grateful for my practice. People, it's just a shift that happens when we can practice gratitude in the mornings. For me, it changes my day. It gives me a different outlook for the day.
Absolutely, it does, man. I look at it as God gives us a new opportunity and a clean slate to refresh and start brand new, man. So I love that. If anybody wanted to work with you, book you as a guest on their podcast, or they wanted to learn more about your practice, Dr. Mark, how could they get a hold of you?
They can go on Google and they can just look up markmcnear.com. And my website, there's a place there where they can contact me. It's for patients, new patients, or for people who want to contact me who are interested in having me on as a guest for a podcast. They can also email me at info@markmcnear.com.
Absolutely. Well, Dr. Mark, like I said before, man, I thank you for coming on and sharing your story. I thank you for coming on and being totally transparent and vulnerable with your story, especially coming from a men's perspective. Some guys would not come on or even at this stage in life to share their story and talk about some of the things that occurred to you. So I just want to tell you thank you, man, for coming on here and sharing your story. I truly appreciate it.
Thank you for inviting me, Michael.
Absolutely. Until next time, guys, God bless.
Can't complain at all. Couple dollars in my pocket, no income and go. Been working on my body, getting healthier. Thank God for clarity.